And I think going into nursing, a lot of people think the pay is good. Let's go into nursing, that career, this and that. But to be a nurse, you have to really love it. Like you have to enjoy caring for people. And there's a lot of sacrifice. Every day I'm still learning. I mean, I've been in the field for 13 years, and there's not a day that I don't learn something new.
Welcome to the Job Dictionary podcast. Today, I will be interviewing Margaret de la Cruz to learn about what it's like to work as a family nurse practitioner. Margaret, welcome to the show. Thank you so much for being here today.
Hi, Alexia. Thank you for having me. I'm very excited.
Of course, we're super excited to have you on. So, we're going to go ahead and start right away. Three questions that we always like to start off with are, in your own words, what do you do? Where do you live? And then, when you were a kid, what did you want to be when you grew up?
Yeah, so I am a family nurse practitioner. I am a registered nurse by trade as well. I am a health provider. I evaluate patients, I educate patients, and provide healthcare. I grew up and was born in Brownsville, Texas. And what was the other question?
And the last question was, as a kid, what did you want to be when you grew up?
Actually, as a child growing up, I wanted to be a kindergarten teacher for as long as I can remember. Um, Probably starting in like eighth grade, I started to really have a love for science. And then as I transitioned into high school, I started to get a little bit more exposure to the medicine field. And
Okay.
we had a job fair in high school. And I remember seeing a nurse, and I just really gravitated towards that. And my career, I guess, pathway changed from wanting to be an educator to being in healthcare.
Nice. And how long have you been working in this field?
So I graduated as a registered nurse in 2011. So I've been a nurse for 13 years. And then I went back to school and I got my nurse practitioner degree in 2019. So 5 years as an NP.
Wow, good for you. And I know you kind of touched on this at the beginning, but just to elaborate on the story, how did you kind of want to get started in this career path? So, what made you want to get your start?
Yeah. So as I said, there was a job fair in high school. And I remember a nurse explaining what she did. And I liked how they were talking about being advocates for patients who aren't able to speak for themselves and just bringing them back to better health. And so I said, okay, health, educating, um, just providing that healthcare just really interested me. So went into that.
And I know you said that you graduated in 2011. What did you go to school for? And then are certain degrees required to be a family nurse practitioner?
Yes, so I went to school for registered nurse. It was a 2-year degree. So I went into college like late 2008, did some summer classes. Took me a couple of years, got my associate's degree in nursing. I went back to finish my bachelor's degree in nursing. I know there are so many different like bridge programs. You can go straight out of high school to a
Hmm.
bachelor's SN. But I did it that way. I did 2 years of RN school, an extra 2 years to do my bachelor's. And then I actually went back to get my first master's degree in nursing, but in administration, nursing administration. Decided that wasn't for me. And so went back for nurse practitioner. And that took like an additional year and a half. So yes, you do need to have a nursing license as a registered nurse, and then you get your degree as an advanced practice registered nurse.
Wow, lots of education behind this role, lots and lots of years of school.
Yeah, which is understandable. I mean, you want somebody who's well trained and well versed in the field, who's going to be taking care of your health.
Exactly. And whenever it comes to being a nurse practitioner, are there any other job titles that this position goes by, or is it primarily just nurse practitioner?
So I guess a lot of people will just say like nurse or registered nurse. Um,
Okay.
but I mean, advanced practice registered nurse. And then you have so many different type of specialties when it comes to being a nurse practitioner or NP. You have family, you have psychiatric, you have pediatric,
Mm,
you have, but again, like you have to specialize in each field. I personally chose family nurse practitioner so that I could have different options, whether I wanted to treat children, adults, geriatrics. It was just a better option for me. But yeah, some people just say nurse, but really you're an advanced practice nurse. So, or
got
a mid,
it. And
we'll say mid-level practitioner.
Okay, interesting. So, what would you say is the major difference between being a registered nurse and then being a family nurse practitioner or a nurse practitioner like yourself?
Yeah, so a lot of people decide to go back to school to be a nurse practitioner because, so as a registered nurse, there's so many things you
Mhm.
can do. You can work in a hospital, which is bedside nursing. You can do home health, which you provide home visits. You can be a nurse educator. You can do administration, but it just depends what field you want to do within nursing. But when you decide to take your practice further and you become an advanced practice nurse, the main difference is you have the authority to diagnose patients and prescribe medications.
Got it. What are the specific tasks that you spend the majority of your day doing? So I know that it can vary a lot when it comes to healthcare, but kind of like a regular day-to-day basis, what does that look like?
Okay, so I'm going to speak for myself. Again, like I said, there's
Mm.
so many different types of nursing and nurse practitioner jobs that are out there. But me, myself, I work in a cardiac pulmonary rehab. So
Okay.
I, in the outpatient setting, it's a clinic, and I deal with patients who have had a heart attack, who have had an open heart surgery, or who are suffering from pulmonary diseases. So I work Monday through Friday. Again, that can vary. So I'll just
Mhm.
throwing that out there. Um, so I work 8 to 5 Monday through Friday, and I provide education, exercise classes, and I create treatment plans for these patients who have suffered from cardiac events or have pulmonary disease, as I said. And I'll go in at 8 o'clock, look at my schedule, see what patients I have coming in today. I usually see about 25 to 30 patients a day.
Okay.
Um, and when I get there, usually have 1 to 2 patients that are scheduled to have a stress test. So these stress tests are ordered by their cardiologist and they come into the hospital to have it done. And I'm supervising while they get that done. That takes a good 1 to 2 hours of my morning while I have other staff members dealing with the patients in the cardiac rehab. When I'm done there, I go and I supervise the cardiac rehab, provide education for patients who have questions regarding their health, regarding their medications. Some of them need me to get in touch with their doctors, so I'm collaborating with their doctors, with their other NPs.
Mhm.
And then that's like my morning. And then afternoon comes and I'll have like a meeting or two, maybe every other day. And that's like with administration, whatever I have to get done. Um, I manage the cardiac rehab, so I do a lot of like managerial work as well, aside from patient care. Um,
Okay.
and yeah, so the afternoon is pretty much just exercise, going over the treatment plans with the patients. I collaborate with the dietitian as well to provide education for them, kind of manage their diabetes as well. And then my day's over by 5. So
Wow. But in that day, there's a lot of multitasking, a lot of different places that you have to be, different people you have to see as well.
yeah, yeah. In this role specifically, I do not prescribe only because, and I can, but I get so many different patients that have different cardiologists. And in the
Okay.
state of Texas, you, as a nurse practitioner, as a mid level practitioner provider, you have to have a supervising or collaborating physician looking over your work. So I have my own, and that is why I personally don't make medication adjustments for these patients. I do give recommendations. Like if their
Okay.
blood medication isn't working out for them, I will call their provider and say, look, I don't think this medication, I think maybe they need to adjust their dose. And so I'll make an appointment and they'll follow up with their doctor. Um, that's the only difference in my particular role.
Got it. And you did mention that this is just in the state of Texas. So does it kind of vary? Do the tasks vary from state to state?
Yes, there are some states where if you are a mid-level provider, you can open your own clinic, do your own practice. Here you can open your own clinic, but it has to be under the supervision of a physician. So you
Got it.
have to, yeah, in the state of Texas and in a couple of other states. Don't know them off the top of my head, but some states you can practice independently.
Got it. Good to know. So whenever you're performing these tasks, do you use any certain tools or technologies to kind of help you get those processes going?
Yes. So basic nursing is my
Mhm.
stethoscope. These are my
Mhm.
ears. So for every patient, I do a head to toe assessment when they come in. So I'll listen to their heart, make sure that everything sounds okay. If they have a murmur, or if I notice anything different, I'll mark it in their chart. Um, I listen to their lungs as well, make sure everything sounds good respiratory wise. We have blood pressure machines, which is just a common tool for most people in healthcare. I
Okay.
have a pulse oximeter. This is a pulse oximeter. It measures their pulse and it measures their oxygen level. And then I brought my little tools so you can see them.
Yeah, awesome. I'm loving this.
These are my calipers. So I use these for my patients that I do stress tests on. As I'm having them do a stress test, it prints out an EKG throughout to see if there's any abnormalities. And I have to measure them to pretty much get the accurate EKG rhythm.
Okay.
And what else? That's pretty much it tool wise. Oh no. Okay, so then inside the cardiac rehab,
Uh-huh.
uh, my patients exercise for about an hour. And so the whole point of the cardiac and pulmonary rehab is to improve their endurance and, you know, identify any issues they have while stressing their heart, right? Um,
Mhm.
so while they exercise, we put them on a wireless heart monitor and it goes on their chest. Not all cardiac rehabs have a wireless one. Ours is pretty advanced. It goes on their chest and they can be exercising, let's say, on a treadmill. And they'll be across the room. And from my computer, I'm able to see their heart rhythm. And that's technology. It's state of the art. It's called Ergoline. And all the machines, it all connects to my computer. I'm able to adjust the speed and everything like that. So those are the tools and technology I use.
Whoa, those are a lot. Did it kind of take a while to get used to how those work? I mean,
It,
it sounds, yeah, it
yeah,
sounds
it
like a
did.
lot.
And so you don't have to be a nurse to do that portion. I
Mhm.
do have 3 exercise physiologists that work with me, and they're able to navigate that technology as well. Um, they don't use the stethoscope. They don't do anything assessment wise just because they've left that into the nursing field. So I do that for them.
Noted. Okay, so when it comes to your profession, what parts of your job are the most exciting to you?
In my specific role right now, it has to be having a patient that comes in completely debilitated. They come in post-op after having an open heart surgery, very weak, a very in a lot of pain. And let's say they come in with a walker just because they have some limitations and they find themselves to be pretty fragile. Um, they come in pretty timid, afraid to use any of the machines, and not realizing the strength that they do have. So they're
Mhm.
with you for 3 months. Usually, the doctor prescribes 3 months of cardiac and pulmonary rehab. And I see them come in from day one, barely walking. And then in the end, we have a little graduation for them. They finish their 3 months. They're walking, they're able to run, they're doing all these tasks on their own. And I see their incision also like heal from day one to the end. And it's very rewarding. So that's my favorite part.
Yeah, I can imagine how rewarding that must feel to you that you have a part in that process and kind of seeing them go from one stage to the end. That must be so, so rewarding. Now, kind of on the opposite side of that, what parts of your job are emotionally draining or challenging? Or I always say that I doubt it can get boring in healthcare, but even boring, what are kind of those negative sides?
There's a few. I don't want to be pessimistic, but because I am with these patients for 3 months, I do get emotionally attached to them and I hate to
Of
see them go.
course.
I hate to see them graduate. It's bittersweet. So sometimes I get pretty sad, but there are also unfortunate times that these patients are vulnerable. They're sick, and we can't control what plans are in there, you know, that God has.
Yeah, sure.
And they unfortunately sometimes they pass away. So that's difficult because we see the family go through that loss and just in general, also during the pandemic, there was a lot of death and a lot of unknown. So just that dealing with the loss of a patient.
Yeah, I can't imagine how hard that must be. In your years that you have so much experience, so in those years, have you kind of figured out a way to sort of not necessarily detach yourself, but tips on how to continue after a loss like that?
You have to look at the positives. Like I said, the patients that are successful and what you did do right. You can't beat yourself up about what's the inevitable for some
Yeah,
things. Mhm.
yeah, exactly. And are you able to leave all your work at the office, or do you ever have to take work home with you?
Um, it's very rare that I'll have to bring home work. The only time maybe if I have like a deadline for the administrative part. But
Okay,
again, that's very rare. Usually I am able to leave everything at 5 o'clock at work.
clock out, right.
Mhm.
As a nurse practitioner, are you able to work flexible hours in a remote or hybrid setting, or is it usually just more common to work in office set hours?
No, and I'll just speak like in general. Again, mine's in the office,
Right.
but no, as a nurse practitioner, there are so many opportunities to have like the remote work from home. You can do like visits on the phone. They have like telehealth now,
Telehealth, right.
there's a lot of opportunities that you can do from home and hybrid as well.
Okay, interesting. Are there any busy seasons in this job? If so, which parts of the year are usually the busiest for you?
So for me in my clinical setting, the summer gets pretty busy and the holidays die down.
Okay.
Um, because it's a rehab. But I do know I did a lot of clinical experience in urgent care. And of course, there the busy season was winter time, holiday time, because everybody's getting together, they're passing their germs back and forth. So I guess it can vary in whatever setting you're working at.
Why do you think that the summertime is the busiest for you? Do you think it's because of the setting that you're in, the kind of rehab
Yeah.
and cardiac health, all that?
Yeah, because since it's rehab, I guess this is like depending on their job, like they'll have more
Okay.
time to be able to do these things for themselves, or they're visiting our winter Texans come down and they're here to like March, April, May, and they'll get that done.
Got it. Very true. So just kind of varying on the type of clinical setting that you're in.
Yeah.
What do you think that people underestimate about this profession? Is there anything that comes to mind?
I think it goes back to what you were saying about the emotional part.
Mm,
Um, we are human, and I think a lot of people forget that we do get emotionally attached to patients, or sometimes, doctors can talk to us in a way like we aren't at the same level. So I guess as a nurse in that aspect, as
mhm.
a level practitioner, I think a lot of times, and I understand this, they'll patients will want to see the physician. So they'll request a physician opposed to a nurse practitioner, and they'll say, no, I want to see the doctor. But really, we did go through a lot of clinicals and training and education to be able to diagnose you and prescribe medications that are going to help you get better. So they underestimate, I guess, our position.
Got it. Okay, that does make sense. I can see how that kind of can have a shift in the difference of positions that there are in healthcare.
Mm-hmm.
And then what do people typically overestimate about this profession? So it can be a very overhyped idea, something that you see as extremely positive of an assumption or extremely negative. What do people typically overestimate?
So this one's going to go into the underestimate and overestimate, because some people are like, oh, you're a nurse practitioner, you're like a doctor. So they'll overestimate that, and they'll be like,
Got
oh,
it.
okay, you're a nurse, you're not a doctor. So it can get kind of confusing there. And I think going into nursing, a lot of people think the pay's good. Let's go into nursing, that career, this and that. But to be a nurse, you have to really love it. Like you have to enjoy caring for people. And there's a lot of sacrifice training for it and going to school for it. Um, and the pay can vary, like depending on what you decide to do. Um, but you will learn like a year into the career whether it's for you or not. So people
Wow.
over like, okay, let's go into nursing, great pay, but it's emotional, it's physically demanding as well. So yeah.
Right. Yeah, that's a great point. What do you think is the fastest way to get into this profession, especially if someone kind of has a non-traditional background and they want to start getting into nursing? What would you say is the fastest way to get into it?
So a couple of things. There's people that there's so many ways you can become a nurse nowadays. Like I said, you can do the 2-year program, you can do the 4-year program. But there's people that have no background in nursing and decide they want to be a nurse, and that's fine. They can do your program. But I am aware now that there's also something called like a direct master's in nursing, and you can have like a 4-year degree in something that is non-nursing. They're not everywhere. I think you have to like look for them online. But
Okay.
yeah, if you're whatever, like let's say undergrad classes you have, see what qualifies, what doesn't. And it's like a bridge program, I guess. That usually takes, I think, like 3 years, 2 to 3 years.
Interesting. Yeah, that has to be something new. I haven't even heard of that yet. That's
Yeah,
really good to know.
I think it's like
Yeah.
direct MSN or something like that.
Wow. So kind of just always changing, always evolving,
Oh,
especially in the healthcare industry.
yeah, it's just making it more accessible to people because there is such a high demand for people in healthcare and for nursing in general. Um, so that they make it accessible. It's doable.
Right. What other fields are people coming from before getting into this profession? Do you usually see that it's kind of random, or are there themes where they usually just go to school, become a nurse, and it's kind of like a straight pipeline?
I've seen all different types of backgrounds. I've seen like mechanics, I've seen realtors, I've seen teachers, and they realized that they wanted to do healthcare. And so they come into nursing, but all kinds. It's pretty
Wow,
broad.
that's super. Yeah, that's really interesting. What does someone have to be really good at in order to be successful in a career like yours?
So you said the word perfectly earlier, multitasking. You have to be
Mhm.
able to multitask. You have to pretty much plan your day and expect that there's going to be bumps in those plans. Um,
Right.
so multitasking, you have to have pretty good memory recall, if I'm being honest, because a patient will tell you one thing, you kind of have to hold on to that, remember it for later. Um,
Wow.
yeah, you have to have good observational skills because you are doing an assessment on a patient. Um, Communication skills is a must. You have to be able to carry on a conversation with the patient. You want them to feel comfortable. You want them to open up to you and create that rapport with each other. So definitely communication, memory recall, and multitasking.
Wow. And then how long does it usually take to get good at those aspects of the job? You can speak on just your experience or kind of an overall picture.
So the schooling is there. You're going to get your schooling, you're going to do your clinical hours, but you really don't know what it is to be a nurse until you're thrown out into the field on your own. Um, every day I'm still learning. I mean, I've been in the field for 13 years and there's not a day that I don't learn something new. Um, how you can call yourself good at something or not, it really just depends on the person. I really didn't feel like I was ready to become an advanced nurse until I had 8 years. Um,
Oh,
but okay, I think I'm ready to advance my practice. I've seen people that have only been at the bedside or only been a registered nurse for a year and they're ready to go and advance their practice. So it's really an independent thought, I guess.
right. It can vary from person to person. And I'm sure the state that they're in, the clinical setting that they're in, also plays a big part into that kind of getting used to the job.
Definitely the clinical setting. You get different exposure everywhere you're at. So
Yeah. And is there a promotion path when it comes to being a nurse practitioner? And if so, what does that typical promotion path look like?
yeah, so if you want to do clinical, depends on what clinical setting you're working at. And then there's also there's the education route. So I have a master's in nursing. You can get your doctorate as a nurse practitioner. Really, I
Mm.
don't that I know of the tasks, all of that is the same. It's just about having like a doctorate or a master's, and it is going to open more opportunities for you. Like, say you want to do education at a university, you'll be able to be part of the faculty for that. But if you're in the hospital, there's always room for you to climb up the ladder as far as administration. But nursing, I mean, you start out as a registered nurse, you become a charge nurse, that type of deal, with experience.
Yeah. Do you typically see registered nurses going into the nurse practitioner profession?
I do. It's become a lot more popular. A lot more people are opting out of becoming an associate's nurse, like the 2-year degree, and they're going straight into a 4-year degree. It also depends on what um, what universities are available to you that you can, apply for and attend. So they'll do like the 4 year and then they decide they want to go into NP, opposed to like a master's in education or administration. I see the NP a lot more.
Wow, why do you think that is? Why do you think so many people are doing the switch from the 2 year to the 4 year?
Actually, a lot of hospitals that I know of require it now. It's
Oh,
because of the hospital depends what hospital you work for. Some corporations want nurses that have their 4 year degree because they have a magnet status that they are trying to achieve, more prepared educationally for their staff.
okay, that's interesting. Yeah,
It,
I wanted to like see that transition.
yeah, it can get competitive.
Okay. And then whenever it comes to salary, what is the average salary of someone at your position? It can be broad or kind of a range, even if it varies. I'm sure it does vary from state to state. What does yours typically look like?
Yeah, does vary from state to state, and
Mm.
that's for RNs and NPs. So for, let's say, an NP that has no background, and it's going to also depend on if you're working for a private practice, if you're working for a corporation, that type of deal.
Got it.
But
Okay.
let's say you were to Google it, you're going to see like starting salary of 105, 105,000 a year.
Mhm.
And it can increase to like 120,000 to 160 highest range.
Okay. Yeah, that's a pretty broad range. I guess it just depends, kind of like you were saying, where you're at, what clinical setting, the state, all of that has a factor, plays a role in it.
Experience has a lot to do with it.
Got it. Whenever people in your field move on, what kind of work do they usually go into? So again, is it random? Do you see themes? Or do people just kind of go into anything after being a nurse practitioner?
Um, I don't see too many people leave the field of nursing just because there's so many things you can do, like the education route.
Hmm.
Don't You end up deciding I don't want to deal with patients, but I do like being a nurse. You can go into education, teaching students, right?
Oh,
Administration, you don't have to deal with patients either. Um, but home health is something a lot of people like to do. There's also nurses that go into like selling products, like representatives for different drug companies as well. But leaving nursing, it would be broad if I were to say somebody left nursing and decided to become this or that.
right. And do you see that a lot of people typically just retire as a nurse practitioner, spend their entire career dedicated to that field?
Yeah, and it takes a long time for a lot of MPs to retire. They decide to work for many, many years. Um, but yeah, they'll stay in NP. A lot though, I will see end up doing the education route, becoming educators for RNs or LVNs, because they don't really want to let their license go because you have to be active to keep your license active. So they'll do like something like that. And then now you can do education from home, right? Like you can do online classes and stuff like that as an
Yeah.
educator.
Exactly. There's so many options out there, especially in healthcare, and healthcare is always changing, it's always evolving. So I'm sure
Mhm.
that as the years continue to progress, there'll be even more things that people can go into while staying in the nursing industry.
Yes. Mhm.
Are there any books or resources, programs, certifications that you used that kind of helped you in your career that you would recommend to someone?
Um, for RN, it was so long ago. I'm sure a lot of that is outdated. So I want that. We were using like discs to do like questions. There were no apps back then.
Wow.
Yeah. But for my NP, there's one that's well known in the NP world, and it's called the Amelie Hollier Nurse Practitioner Review. And you can purchase it. But you can also attend like her conference. It's like a 2 day thing. And she prepares you for your state exam because you have to take your state exam to get your license. And
Got it.
yeah, so you graduate, study for boards, take your board exam. So Hollier Review, she's great. I took her class. Um, there were a few other ones that I had like seen on social media. There's an app that I use currently in my practice. It's called Hippocrates. And when I get stumped on trying to remember like a certain medication, I look it up, able to find it. So Collier, I was successful with her.
Wow, yeah, those sound like some pretty great resources. Well, Margaret, you have provided such wonderful advice and insight into what it looks like to be a nurse practitioner. Just to kind of wrap up our conversation today with our last question, what would you tell your younger self when you were at the beginning of your career?
Okay. Baby nurse Margaret. We call ourselves baby, and it's a known quote when you graduate that nurses eat their young. You'll
Oh,
go. It is known. You will hear it if you're a nurse. You will know where I'm coming from. You're fresh out of school. You're just so it's so obvious you're a new nurse, and the senior nurses, they can, I don't want to call them bullies, but they know their stuff, right? So
Mhm.
sometimes like it's a tough love type of situation and they're building you up, right? um but to not get discouraged, I would tell myself, don't get discouraged. You're going to be in that same position one day, but don't be mean to the baby nurse.
You're gonna
And
be different.
yeah, no, but to also realize that every mistake is a learning opportunity and it's only going to build your career. You learn from every mistake that you make in any field, I'm sure.
Yeah. Wow, how awesome. Well, thank you so much for your time today, Margaret, for taking the time out of your super busy schedule and getting to share with our listeners today. I'm sure they can listen and take up as much advice as they can with everything that you shared. We really enjoyed having you on the show.
Yeah, thank you. I hope I can help somebody decide to become a nurse one day and answer any questions they had.
Yeah, thanks so much. Have a great day.
You just got one episode closer to learning about the world of jobs out there. To explore the rest of our career categories and find your best fit, go to jobdictionary.com to sign up for the beta users waitlist. Then subscribe here to find the next episodes coming out this week. And as always, drop us a comment, review, or message to let us know how we can better attune our episodes to your specific needs. Follow us on TikTok, Instagram, Facebook, LinkedIn, X, Threads, Pinterest, and wherever else you're on socials to go get our short, snappy preview reels that expose you to new job options every day. Because here at Job Dictionary, we believe your big aha moment can be just one scroll away. Go check it out and get out there. Cheers!